nothing beats starting with a little bit of a technical issue, but it is totally fine. Good afternoon, good morning in Paris. Good morning, everyone. Lovely and excited to be joining the conference this year. So before diving into the full subject, I'll just give a short overview about short introduction to myself, who we are at Swoop, the key problem we've identified and that we're solving, what we do, and how the system works behind everything we're doing. So my name is Sabrina Raval. I'm the head of commercial at Swoop, and I lead the commercial strategy and work both with existing partners and new partners to define how to best integrate air logistics along traditional supply chains. Before joining Swoop, I worked for 10 years in commercial roles across multinationals, including Porsche Design, Lorna, Jane, and Revlon, and also in Paris for some time. Who we are as a company, I will probably try and mitigate additional issues on the technical side and not share my screen because I'm now a little bit scared. So apologies, you'll have to just listen to me instead of looking at pretty pictures, but very happy to share anything after. My email is sabrina@swoop.aero and very happy to respond to any additional questions. So Swoop Aero is an Australian drone-powered health logistics company, and our vision is to transform the way the world moves essential supplies by making access to the air seamless. We are basically bringing healthcare logistics into the 21st century by deploying two-way drone networks. And our goal as a company is to provide a sustainable logistics service to 100 million people by 2025. So the key problem we have identified and that we are solving is that an estimated 3.5 billion people, or more than half of the global population, lack access to basic healthcare. So in 2017, for example, the World Bank and the World Health Organization estimated 100 million people as well were pushed into extreme poverty due to the cost associated with access to and provision of basic healthcare. The challenges posed by COVID-19 have only magnified these inequalities in the global health sector and highlighting issues of access, availability, and distribution of essential health supplies across low and middle resource settings. During this pandemic time, national governments all over the world are united in the shared responsibility to effectively equip, test, and treat on their national populations so as to prevent the further spread of the virus. The cost, provision, and quality of basic healthcare is in part attributable to the effectiveness of the global health supply chain to overcome logistic barriers, such as, for example, poor transportation networks, weak infrastructure, unpredictable waterways, and challenging geographical terrain, which lead to high cost of transporting essential healthcare products, from vaccines to medications to pathology samples. So global healthcare governance is strengthened when everyone, everywhere, has access to the basic healthcare they require. And that begins with providing the supplies that healthcare workers need to give treatment, and that is where Swoop Aero, so where we come in. So what do? We provide a logistics platform that leapfrogs ground-based solutions to existing infrastructure barriers. So we integrate air transport into the last and the first mile medical supply chain, which traditionally are also the most expensive ones and the most difficult to overcome. And we overcome them to enable reliable provision and distribution of vaccines, routine medication, pathology samples, or PPE equipment. And we provide a full technology platform to seamlessly integrate drone logistics into operations. So we don't just look at air logistics by itself, we look at it across and alongside traditional means of transport. As a commitment, so our service commitment, our core commitment is to provide the world's leading technology platform for safe, reliable, and sustainable drone logistics. And the key to our success is that we provide a fully integrated and connected aviation platform, not just a drone. We also have a strong safety and regulatory record across a number of countries, including Malawi, Mozambique, Vanuatu, and DR Congo. So how does the system work? I'm sorry, I don't have pictures now to support that, but essentially we've built a full aviation system that we operate as a fully managed drone logistics service to deliver healthcare commodities to the places they are required on demand. And since our first project in Vanuatu in 2018 with UNICEF, delivering vaccines for childhood immunization project. We have rolled out drone delivery networks in Congo with Village Reach and with funding from the Gavi and Gates Foundation, as well as in Malawi with UK Aid and USAID and UNICEF, and in Mozambique with UK Aid and Village Reach. And so we are integrating air logistics alongside traditional transport and operate it as a single network. So what makes our solution innovative? So Swoop Aero's healthcare logistics revolution is based on advanced mechanics innovation and ingenuity and applying deep aviation knowledge. So we use a hub and spoke model, basing drone logistics operations usually at a large regional hub or urban hospital where most medical commodities are stored and where pathology services are located. And the network then services spokes locations or regional healthcare facilities where healthcare workers can administer drugs, vaccines, in the future, hopefully as well, COVID-19 vaccines, or take samples without the need to store commodities at each location. And what this two-way logistics network ensures is essential supplies can be delivered to their specific locations, and upon returning to the central distribution hub, pick up blood samples, test pathology results, or essential medication, and that optimizes the efficiencies of all healthcare facilities in the area. So that is how our overall operation functions. Sorry, I just got distracted for a second. And where we have run successful operations to date is so we have deployed our service across 4 countries and have in those countries created more resilience across the supply chain. So the current global pandemic only served to highlight that finding solutions in this space is a requirement. So the 4 countries we've operated in are Vanuatu, DRC, Mozambique, and Malawi. In Vanuatu, in 2018, we have written history with a number of firsts. So we became the first company in the world to deliver a vaccine by commercial drone. And we were awarded 2 out of 3 commercial contracts by UNICEF and the Vanuatu government. In DR Congo, we're working with Village Reach and the Ministry of Health. And after a successful pilot in 2019, we are this year expanding our operations to cover 100 villages with 5,000 people in the Equateur province. And the network will cover 22,000 square kilometers, which will be the largest two-way drone logistics network in the world. To only name a few efficiencies that were created as part of the drone logistics network. Previously, for example, it could take up to a day to travel from Bandaka to some of the regional healthcare centers. Particularly in the wet season, that became more difficult. So that was in DR Congo, and then it is also a bit difficult to do that without a visual guide, but that is fine. So in Mozambique, we then became the first aeromedical logistics company in 2019 to obtain BVLOS, so Beyond Visual Line of Sight approvals. And we were able to fly over populated areas, and this approval allowed us to quickly deploy the service to transport TB and COVID samples. And so we've just finalized the initial phase 1 with funding from UK Aid and are hoping to return into that region further down the line. So we've looked at what we've done in Vanuatu, how we've changed operations in Congo and Mozambique, and I will have a more in-depth look at Malawi, which is one of the countries we are operating in at the moment. And then the one that you will see as well highlighted if you go onto the project page. So in Malawi, we started initially in 2019. And so following the opening of the humanitarian drone corridor in 2017, UNICEF and USAID released a global tender for unmanned aviation services to complete operations in the northern region of Nakata Bay. And so in November 2019, Swoop Aero was picked over an existing operator to deliver urgent cold chain medications and vaccinations in the north. And to date, in that area, we've maintained 100% flight success rate without any major incidents or delays. And we were able to obtain flight authorizations also within a very short time upon arriving in the country. And in the first months of operations, if we look at numbers, we expanded the geographical reach of the district health supply chain, expanding the network coverage from 2 facilities to 6. And we successfully integrated the drone service platform into existing transport routes covered by CDC couriers. They were mainly carrying HIV and TB lab samples between district health facilities and laboratories, and we essentially really helped alleviating the pressures placed on the health system as part of the HIV and TB effort to test within the local community. So I was in the north. In the south, we essentially started in the first months of 2020. And so we expanded operations in the Chikwawa and Nzanja district in the south with UK Aid and UNICEF and the Ministry of Health. And at present, we are servicing 38 health centers across 2 districts via the establishment of 2 drone hubs. So we've expanded the operational capacity since the beginning, the frequency of flights, as well as the volumes of goods by integrating additional aircraft. And we've also seen the use exponentially increase at the start of the pandemic. And the way that we are sustaining those operations is that we have trained more than 70 district health staff across 38 health centers to receive medical cargo, and employed 6 people from the local workforce, including graduates from the African Drone Data Academy, to operate and manage the network. I would love to show you a video, but again, I'm too scared to have anything crash in the background. I'm logging in from Australia, and the internet can be sometimes very shocking. But essentially the way the aircraft work is the aircraft flies autonomously across a pre-planned route and then lands automatically at a destination. And so what that means when we say that we've trained district health staff across a number of health centers is that they have been trained to safely receive the cargo, safely send it back. And the aircraft basically is about 1.5 times 2 meters big, has a cargo pod in the middle. Again, if you look at the on the project page, you'll see a video that will illustrate it better than my words. And essentially by pushing a button, the aircraft returns to its destination automatically. So that is a bit more to kind of like try and visualize it. And in terms of achievements, I think it's worth highlighting the numbers that we're looking at, because they have increased since we looked at Vanuatu and the first phase in the Congo. So since February, for example, delivered 50,000 doses of HIV antiretroviral medications. We've delivered more than 12,800 doses of vaccines, including polio, rotavirus, and PCV. We've delivered more than 1,500 COVID-19 face masks, transported over 700 lab samples, and flown over 60,000 kilometers. And we fly on demand. So this is for routine deliveries, but we also send emergency supplies. So that's particularly important when distance is of essence and time is of essence. And so we have at least since the beginning had 1 emergency flight a week. So that can be oxytocin, that can be all sorts of medications that are required to stabilize a patient or to essentially save lives. So in addition, the established operations of the network has already demonstrated critical reductions in journey times. So for example, we have reduced a routine 90-minute journey time down to 9 minutes. So when we then speak about emergency deliveries, that becomes of essence. If we look at Malawi as a country, it is at the forefront of adopting advanced technologies in Africa. And over the past 5 years, the Ministry of Health and Population has already conducted projects which have leveraged drones to deliver or improve health outcomes across a number of settings. And Swoop Aero has remained the leading drone logistics service provider for some of those projects. And we're looking at developing and scaling up a national network with the support of and the leadership from the Ministry of Health and Population, as we look to scale our impact and improve access and availability to his health supplies during the pandemic and obviously beyond. And while initial funding has come to an end, and that is the nature of donor funding, in the north and the south, operations are continuing in the south, and we're sustaining operations in country while we are seeking donor funding to facilitate the nationwide network, which will see us reach 15 to 20% of the hard-to-reach facilities. So those are the ones that get flooded. Those are the ones that are cut off for months and months during the same year. And if you're interested in acting as a potential donor or want more information about our operations, please feel free to get in touch with me separately after. So what's next in Malawi? So over the next 5 years, Swoop Aero is focused on transforming access to essential healthcare supplies. And as I highlighted at the beginning, our goal is to reach 100 million people by 2025. And this growth projection and potential for business development is based on further integration of aviation system and air transportation networks into the existing 5 operational locations across the world. So in Vanuatu, Malawi, DR Congo, Mozambique, and we are an Australian company. I probably don't sound very Australian because I am actually from Europe. But we will be expanding in the Australian region as well as establishing service within the UK, South America, Southeast Asia, and throughout Greater Africa. In Malawi, the goal over the next year will be to scale the reach of the networks to every corner of the country so that it can provide essential supplies needed when required. And over the next 5 years, we'll then look to scale the number of deliveries being made every day to ensure Malawians are accessing healthcare commodities as and when they're needed. Maintaining the service and continuing to expand in accordance with demand, run fully by locals, will be the key to our success. So we do intend on continuing the way that we've started, which is entirely relying on a local workforce. And so our future vision, and I think those will be my closing remarks, because I think time is running short as well, and I just want to make sure that we can answer any questions that might come through. So our growth as a company is rapidly scaling. So we are a startup, we are backed by venture capital, and so we are scaling, but so is our impact, and we keep prioritizing healthcare, which is boosted by working alongside our trusted partners to replicate the service. So what that means, it means continuing to work with the most important figures in global healthcare, including non-government organizations and national ministries of health, as well as developing new partnerships with like-minded and impact-focused organizations across the world. We also continue to build on our experience through each successful project, and because of this, we have developed the capability to seamlessly roll out an universally applicable air logistics system. And at Swoop Aero, we are looking at long-term and self-sufficient solutions to solve inequality of healthcare access through sustainable medical drone logistics. So our vision is not to always rely on donor funding. It is a path to scale. And I think, just as a closing remark, the need for a resilient health supply chain has become particularly apparent during the pandemic, and air transport, for instance, reduces, for example, risk of communicable diseases by enabling contactless transport. So I think that I can just see questions that have come in so far. So in many humanitarian crises, sorry, I'll just read that out very slowly. In many humanitarian crisis contexts, drones are increasingly weaponized. How does this affect the acceptance and potential for your solution? That is a very interesting and very good question. So one of the main pillars that we're working at is, and that is critical to our success, is community engagement. So we would never start operating in a region if we haven't spent the time to engage with the community, and that is engaging on all levels. So that is on ministerial levels, that is on the community level, that is training healthcare providers, that is making sure that we respond to fears, and that we work with the communities we're working in to ensure that we don't just roll out a system that is not wanted. So it is all about ensuring that we work within the communities, and this also allows then to educate about the outcomes that we are creating. And that is also something that we want to work towards, which is having more, and that is something that we're basically looking at with our partner Village Reach as well. For example, we want, as part of the scale up in Malawi, have a full impact analysis. And it's something that we're looking for in DR Congo as well, so that we can also quantify those impacts. But I think that may have responded to the question. So it could affect the acceptance if we weren't doing the community engagement that we're doing. Getting a bit closer to see the next question. Would you mind reminding who your clients are exactly? That is a excellent question. So it depends what we consider as clients. So we do have several levels here. We have those who pay. So we've got those who benefit, and we've got those who use it. So if we look at who is paying, at the moment, we are looking at a blended approach depending on the countries that we are operating in. We are still very much relying on donor funding to run the operations that we do run. So paying organizations will be UK Aid, more recently UK Aid, US Aid, UNICEF. I think, yeah, and essentially we are also working very closely with our partner Village Reach, who is a non-profit based in the UK. Sorry, I just get distracted as well by reading the questions at the same time. But yeah, so our clients, so the paying ones will be non-for-profit, not like NGOs that, or like larger organizations. Benefactors and the ones that are guiding the work are those that are in country. So those will be the Ministries of Health and Population, or Ministries of Health, DHBs, local healthcare centers. And the final users will be the doctors, the nurses, the communities. And the next question is, do you work for national ministries and humanitarian organizations, also for private and sector partners? So that actually leads very nicely into the next point. At the moment, we are working mainly with national ministries and humanitarian organizations, but we are launching a project with a private sector partner early next year. So it will be a February, like early next year kickoff in Australia. So the private sector partner is on the pharmaceutical side, and it will be a way of integrating medical drone logistics along traditional supply chain. But that is an area that we want to develop as well further. The next question that came through, how do you hope this edition of the Paris Peace Forum will support the work of your project? So there are different ways that we're hoping to find support for our project. The first one, which is a very obvious one, or the obvious one for us, is we are hoping to get in touch with funders, donors who may be interested in scaling with us in Malawi and help us grow and be part of this exciting journey. And on that note, being part of an exciting journey as well is we also hope to attract the right talent, because you can't grow an organization without having access to the right people. And that is one element that we're interested as well, is finding out if there are people out there who want to be part of that journey, who want to come on what is has been today a very crazy journey in the healthcare field, and one that is very, very rewarding. And the third element, and that is probably more an annex one, but that helps with the first point and the second point, is support in terms of or more an outcome, which is the more a project is spoken more about, the more likely we will be to also get the support, financial support, and the support that we need across the country. And then the last one is one that I should probably have mentioned as well. So we're also always interested in speaking with potential new partners and finding out where else we can solve the problems of inequality of healthcare access and bridge that gap. And I think I've finished with the questions. So I hope I responded to them. Again, very happy to be connected to anyone and speak to anyone at the end. Separately, my email address is very simple. It is sabrina@swoop.aero. Thank you very much, and sorry for the lack of pictures.